North American health authorities are now taking a lead role in fighting the Ebola outbreak in Africa. A potential vaccine that was developed in Canada is now being fast-tracked for human trials in the U.S. And as Jennifer Johnson reports, U.S. disease experts have also traveled to the epicenter of the outbreak to get a better idea of how bad this could get.
With the Ebola virus devastating West Africa, clinical trials on a possible vaccine scheduled for later this year will begin tomorrow at the National Institutes of Health in Maryland. Developed by the Public Health Agency of Canada, the vaccine is designed to prevent an Ebola infection and has shown great promise in animal studies.
We're going to be putting this vaccine for the first time in humans for what we call early safety studies.
The vaccine delivers one part of Ebola's genetic material to human cells, triggering an immune response. But it will not cause those vaccinated to become infected with Ebola.
It's only through careful research we're going to know whether it works, how well it works, and what the side effects are.
Doctors are desperate for anything that could prevent or cure Ebola victims. Some success has been found with a few doses available of the ZMapp serum, used on Americans Dr. Kent Brantley and missionary Nancy Reipel, sickened while treating Ebola patients in Liberia. A Congolese doctor and a physician's assistant were just discharged from a medical center there after being given ZMapp.
How happy we are that you have survived this. Thank you particularly for coming to our country and rendering service.
Over 1,500 people in West Africa have died from Ebola. Liberia, Guinea, and Sierra Leone have been the hardest hit. But the virus is spreading. 16 cases have now hit Nigeria. A team from the U.S. Centers for Disease Control is touring the region, assessing the global threat.
We can neither isolate nor ignore West Africa. This is not just a West African problem. If we don't stop Ebola here, it will be a threat to Africa. It will be a threat throughout much of the world on a long-term basis.
But truly stopping Ebola, vaccinating people so they never get infected, is the ultimate goal. Doctors are hoping the Canadian vaccine is the answer. If it is, healthy people in West Africa could receive the drug sometime next year. Jennifer Johnson, Global News, Washington.